tonight the CDC has a lot more open positions to fill because in the midst of a bizarre back and forth that happened over the last 24 hours about whether or not the CDC director was or was not fired, resignation letters started piling up from some of those senior people who are responsible for shaping public health. 3 of those public health leaders are my sources tonight. They've all spent years guiding the country's response to disease outbreaks and building the framework designed to keep Americans healthy and alive. Dr. Deb Howery was the agency's deputy director and chief medical officer. And more than a decade at the CDC, she briefed the public on everything from diabetes rates to mental illness among children to opioid prescribing recommendations. She joined the agency in 2014 to lead the National Center for Injury Prevention and Control, which dealt with issues like gun violence and suicide. In her resignation letter, she wrote, "Recently, the overstating of risks and the rise of misinformation has cost lives, as demonstrated by the highest number of U.S. measles cases in 30 years and the violent attack on our agency." Dr. Dimitri Daskalakis is an infectious diseases physician, and as the director of the National Center for Immunization and Respiratory Diseases, he ran the team that issues vaccine recommendations. He joined the CDC in 2020 to direct its HIV prevention division, and he spent a year deployed to the White House working to help coordinate the country's response to Mpox. He now says he's, quote, unable to serve in an environment that treats the CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health.